Vraylar is a relatively newer medication and was approved for medical use in the United States in 2015. It's important to recognize that each medication typically has a generic name and a brand name. So Cariprazine is a generic name and Vraylar is a brand name. Now, how does this medication work? Vraylar is considered to be an atypical antipsychotic, and it works by changing the amount of neurotransmitters dopamine and serotonin in certain parts of the brain. In adults, Vraylar is FDA approved for the treatment of schizophrenia, bipolar mania and mixed episodes, and bipolar depression. It is not FDA approved for the use in kids. However, it's commonly used off-label and can treat other conditions such as major depression and other psychotic disorders, bipolar maintenance, behavioral disturbances, and disorders associated with impulse control. Vraylar comes in capsules and dosing is generally between 1.5 to 6 milligrams daily. It only needs to be taken once per day. If I'm using this medication in kids, I'll often start at an even lower dose to help reduce the risk of potential side effects. And my approach is always to start low and go slow, meaning we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. Once this medication is started, it usually takes 1 to 2 weeks to start seeing improvement in manic or psychotic symptoms. If being used to treat behavioral issues, it might take several weeks before you see full effect. Because of this delay, I often recommend starting therapy during this time because the benefits of therapy can be seen right away. So when looking at the common side effects, the top 5 that were reported by patients in clinical trials included extrapyramidal symptoms, akathisia, headaches, nausea, and vomiting. When looking at the more serious but less common side effects, it's worth noting that the FDA has put a warning on all atypical antipsychotics about the increased risk of hyperglycemia, diabetes, and increased blood cholesterol and triglycerides when taking one of these medications. There's also a class warning for higher mortality rates in geriatric patients with dementia-related psychosis receiving atypical antipsychotics. Other rare side effects include tardive dyskinesia, neuroleptic malignant syndrome, and orthostatic hypotension. It's also important to realize that taking multiple medications at the same time might cause one medication not to work as well, or lead to an increased likelihood of potential side effects. So you should always talk to your doctor or pharmacist before starting a new medication, and make sure your doctor has an up-to-date list of all the medications you're taking. When someone is put on Vraylar, it's ultimately unknown exactly how long they'll need to be on it because it's dependent on the condition being treated. Someone with schizophrenia might need to take this medication for years, while someone who's taking it for aggressive behaviors might only need to be on it for a few months until behavioral therapy starts to work. When deciding to come off of Vraylar, please do not stop taking this medication without talking to your physician first, because they can help work with you to come up with a plan on how to stop the medication so that unwanted symptoms don't occur. Some people will experience involuntary movements called withdrawal dyskinesias within the first few weeks of lowering the dose or stopping the medication. These typically go away, but I have seen them persist over a couple of months in some patients following discontinuation of treatment. Stopping the medication suddenly can also lead to emotional disturbances such as irritability, nervousness, or moodiness. Physical symptoms could include stomach aches, nausea, vomiting, diarrhea, sweating, or trouble sleeping. The likelihood of this occurring with Vraylar is thought to be less than other antipsychotic medications given its long half-life. However, make sure to let your physician know if these symptoms start to occur when you try to come off of the medication, because there's different approaches that we can take to reduce these unwanted effects. Now head on over to the next video to find out more ways that you can live your best life.